Hi everybody, this is Dr. Jamie Marich, and today we're going to be working on a skill called body scan. Now, if you've had any experience with therapy or mindfulness meditation, there's a chance that you've worked with body scan on some level. This is one of those skills that I've literally learned dozens of ways to do it. You can really take your time with it and do a very slow, thorough body scan lying down or sitting down over the period of, let's say, a half hour to 45 minutes. Or you can think of body scan as literally that, a scan, like from head to toe, as if you're taking a magnifying glass, just running it down the body and noticing any odd or unusual sensations that may be coming up, really just thinking of it as a body check-in. So what I'm going to be doing in this video really is a bit of a combined version of the two. We're not going to go the whole length of the half hour, nor do you have to necessarily be lying down or in any specific posture to do this. If you want to lie down, you can. If you want to sit down, you can. Nor is this going to be just a really kind of quick, thorough check. Although I do find that if you've taken some time to do a body scan in, somewhat detail like we're going to be doing today, or I should say in some amount of detail like we're going to be doing today, then it does become easier for you to kind of do that quick check whenever you need it. And indeed, we're going to be ending this specific video today with a skill called body cuing, which really is that art of just checking in, noticing what may be coming up in the body. And I do find that it becomes easier to do that when you've been acquainted with the practice of body scan. So let's go ahead and jump right into the exercise. We're going to be doing this over the course of about 10 minutes. So if you could find a position where you think you can be and stay comfortable for about 10 minutes, that is what I would recommend. So if you're lying down, you may want to use a bolster or a pillow under your knees to give your back a little bit of support. If you're in a recliner, that is good too. If you're in a chair, that's also a good option. If you're sitting, my best advice is to avoid that slouch, nor do you have to be, so at attention that it becomes uncomfortable. So just think of kind of allowing the body to fall into just that state of comfortable awareness, whether you're sitting or lying down. And of course, you can close your eyes or leave them open. Okay. So let's take a moment to just check in with your body, noticing the full experience of it, whether you're sitting, you could be standing, or lying down. And in a moment, I'm going to begin to call out a body part at a time. And as I say the name of that body part, in this spirit of mindfulness, in this spirit of noticing without judging, I'd like you to just draw your attention to that part of the body. If it helps, you can say that part of the body to yourself after I have said it. So inviting you to draw your attention now to the top of your head, the forehead, right side of the head, right ear, left side of the head, left ear, back of the head, forehead, nose, right cheek, left cheek, top of the lip, bottom of the lip, jaw, right side, left side, chin. If you wish, tongue inside of the mouth. Front of the neck, back of the neck, right shoulder, Working now down the right arm, right shoulder, upper arm, elbow, right forearm, right wrist, right side top of the hand, bottom of the hand, right side thumb, pointer finger, middle finger, ring finger, pinky finger. Coming to the left side shoulder, upper arm, left side elbow, left side forearm, wrist, top of the hand, bottom of the hand, thumb, second finger, pointer finger, third finger, fourth finger, pinky finger. Noticing now the right side back of the shoulder, down the back, left shoulder, down the back, right side of the chest, left side of the chest, down into your stomach and abdomen, right side, left side, waist, right side, left side. Moving now to your right hip, moving down the right leg. Right hip, right thigh, right knee, right shin, right calf, right ankle, top of the foot, heel of the right foot, bottom of the right foot, right side big toe, second toe, third toe, fourth toe, pinky toe. Coming now to the left side of the hip, left thigh, left knee, left calf, shin, ankle, top of the foot, bottom of the foot, heel, big toe, second toe, third toe, fourth toe, pinky toe. Now take a moment to notice the entire body. You can think of its stream from the toes up to the head or from the head down to the toe. Whatever helps you to be totally mindful, totally bodyful of the experience of just being in your body. So now we're going to move into a bit of body cueing. You can stay in whatever position you're in. And what I'm going to begin with is to ask you to bring up something in your mind that you have a positive association with. It could be something as simple as a color, a nature scene, a word, or a spiritual concept. So just go ahead and hold that positive association in your mind, noticing any details that may be jumping out at you about it, like sight, what it looks like, sound, smell. And as you take a moment to be aware of those details, notice what happens in your body. Maybe it's a general feeling all over. Maybe it's one spot in particular that really highlights itself for you. There's no right or wrong answers with this. Just notice whatever is true for your body. As you hold this positive. So just make a mental note of that. If you know how to use the seal of knowledge mudra, you can just go ahead and seal that positive in if you wish. If you do tapping in any way, you can go ahead and tap in that positive experience. If you need more guidance, we have another video in this series about tapping in the positives. So now if you wish, and this part of the exercise is optional, really all of these exercises are optional for you to engage in at the level of your comfort. We're going to work just a little deeper with body cueing. And if this feels safe and right for you to do today, just as a sake of for experiment, I'd like you to bring up a negative association. I'd advise you not use a big major trauma unless you're being guided by a therapist or a professional, but just something that causes you a moderate amount of stress or discomfort, annoyance. So go ahead and bring up that association right now, noticing again any details, visual, what it may sound like, smell like. And same thing, now as you sit with this negative association, notice what may happen in your body. Again, maybe it's a single sensation in a single place. Maybe it's a general experience all over. There are no right or wrongs. Just notice what's true for you. So you have some options here. If you do have a meditation practice or are used to working in this domain, you can choose to continue sitting with this for a while, just noticing what happens, if that feels safe for you. If that's the option you want, I would suggest you pause or stop the video to kind of see where this takes you. If your experience is, okay, enough for today, I want to come out of this negative, then go to one of your other skills that you may have, whether it is taking a couple nice deep full breaths to kind of clear what's coming up in the body. If you need to do any stretches that you know that really just help you kind of get back to that equilibrium, of course you can do that. There's another exercise in this series called Light Stream, which is one of my favorite guided visualizations for helping to clear some of this residual body material. Or another option is to just bring your attention now back to that positive association. Reminding you if you sealed it in or tapped it in, engaging in those activities can be an option to really help you bring back that positive association. So for the sake of demonstrating on this video, let's just go ahead and do that. Bring back up the positive. And just notice what happens. And if you need a few more moments to stay here with this positive, I advise you to go ahead and take that. If you're still feeling a little out of balance, I would advise you to go to any of the other skills in this series that are designed to help get you out of some of these negative body shifts. The interesting thing about this skill, though, is practicing making these positive and negative associations is how we build body awareness. So if you struggle with craving, if you struggle with being triggered on any level, practicing this exercise will help you to be able to listen to your body when you're out there in real life or in the game that we call life, so to speak. This is the practice that we have to do to be able to listen to our bodies. A saying that I use with my clients a lot is that your body doesn't lie. Your body tells you what's going on 10 steps before your head can even make sense of it. So doing this skill of body cueing, preceded by body scanning for a while, if that's what you need to really help you get used to reading your body, is an excellent way to build that skill, to build that competency. Thank you for joining me today. I'm Dr. Jamie Marich, reminding you to be well.